Hey, I'm Reed.
Hey, I'm Kishan.
We are the co-founders of Describe, and we have a demo here today where we're going to show you 4 parts of a doctor's workflow which we automate. The first is going to be the transfer forms, and any forms that doctors have to manually fill out. The second is going to be the note. The third is going to be the clinical insights, and the fourth is going to be the EHR automation. All right, so we're going to do a mock conversation here. Kishan is going to be our doctor, and I'm going to be a patient coming in with a hurt leg. Okay, we can go ahead and choose our template and start the recording.
Awesome. Hey Reed, my name is Dr. Pansuria. I heard you were having some problems with your leg. Can you tell me a little bit about it?
Yeah, so this past weekend I was on a trip with some family, some friends at like a Boy Scout camp out. We were all just like hanging out around the fire, and it was really dark. I was walking around and I slipped and cut my shin open pretty bad.
Okay.
I thought it was just a cut, so I thought it might be fine, but I'm really struggling to put weight back on it. So I was afraid I
Okay.
maybe fractured something. I'm not sure.
Oh, okay. And how long ago did this happen?
About 2 days ago.
Okay. And has there been any pain in any other part of your body?
No, not really.
Okay. And any other part of your leg?
No.
Okay, gotcha. Is it okay if I examine your leg?
Sure.
Okay. If I touch your thigh here, does it hurt?
No, it doesn't. It doesn't hurt there.
Okay. And can you move your leg, or does it hurt when you move your leg?
I can move it. I just can't really put weight on it.
Okay, gotcha. And here, if I touch your shin, does it hurt? Is it hurting now?
It hurts there. Probably like a 7.
Oh, wow. A 7 out of 10 pain?
Right.
Pretty severe. Okay. Well, let's get an x-ray done.
Okay.
Looks like the x-ray result came back.
Wow, fast.
So you have a severe fracture here on your tibia, which is your shin.
Okay.
We won't be able to treat it here. It requires surgery. You're going to need to get some screws and a metal rod placed in your shin. We're going to send you to South Miami Hospital Baptist. You'll be able to get your surgery done there. There's an orthopedic surgeon there on call. The surgery team is ready to perform the surgery as well. So the ambulance will move you over there. They'll be here in about 10 to 15 minutes. But yeah, in the meantime, for your plan, let's have you take morphine. You'll take IV morphine, and that should relieve some of the pain in the meantime. And do not put any pressure on your leg. Don't walk until you get to the surgery center.
Okay.
So yeah, any questions? Anything else?
No, I think that's about everything.
Awesome, sounds good. Well, have a great day, Reed.
All right, thank you so much. We go ahead and stop the conversation here, and we see the first thing that were generated were the transfer forms. So these forms are actually already generated as the conversation goes on. So we can go ahead and open this up, and I can zoom in here. We can first see the patient's condition, so we can deduce that the patient was stable. The AI was able to deduce that. Okay, it's also able to fill in information about the physician based on the account information. So this account is for Dr. Pansuria, Kishan Pansuria. It's also able to determine the location for the doctor because that's what's in the account. Okay, it's also able to deduce the reason for the transfer as well. So in this case, equipment or services were not available at the urgent care facility, or in this case, the orthopedic surgeon was not present. Okay, if you scroll down here, it's also able to put the date and time, as well as determine the mode for the transport, or in this case, the BLS ambulance. All right, so we can close this and just go back to the note section, and Dr. Pansuria can walk us through the note.
Yeah. So based on our conversation, this note was generated to this template. So we can see here that first the HPI was generated, which is essentially a summary of the subjective report from Reed and his problems. And then we can see the review system. So it bolded this because this is what Reed had subjectively reported in the conversation. And then we can see the physical exam was picked up. This was bolded here when I physically examined Reed on his leg. And when I touched his shin, there was pain. And so it reported this in medical terminology as tenderness. And then here is the medical decision-making box. So we can see that it picked up on review of diagnostic results, and we can see that it picked up on the x-ray that we did and the results of the x-ray, which was a severe fracture requiring surgical intervention, which is what we discussed. And then it determined the risk assessment as well based on that. Here's the rationale, prognosis, and plan, which are all custom generated based on the conversation. And yeah, here we can see that we had a follow-up with the surgical team, just correct as the plan. And then here is the clinical insight section. So it extracts all of the decisions or medication that was prescribed, and then justifies it or doesn't justify it based on the most recent medical guidelines from like the medical American Medical Association or UCA, for example, other organizations. So it seems like all the treatments were justified. And then here is the missed opportunities for billable care section. So here are some things that I could have mentioned or I could have done to be billed to add another billing code. So here we can see that I could have done counseling a little bit for post-operative recovery, and then this CPT code could have been used, for example. And then here's the peer treatment insight report. So this will go ahead and pull all the data from other providers within Baptist Health Urgent Care that faced similar issues and did similar treatment. So we can see that 100% of physicians that had a similar case, here like 12 similar cases were seen, and all 100% did an x-ray confirmation. But we can see that only 67% did patient counseling on non-weight bearing status, and it'll provide the justification as well for that. And then here's the provider interaction audit. So there are a few things that in Cutler Bay, we want to make sure we're providing as like small talk for patients. So the AI picked up that I did not acknowledge the weight when seeing the patient, but it did acknowledge that I introduced myself properly to read in the beginning, and I asked him open-ended questions.
All right, and then the last section here is the quick actions. So this is more on the EHR automation side. So the way Describe works is it sits as a layer on top of your EHR. So any changes done for Describe is automatically synced and updated to your EHR, or in this case, Cerner. So in this case, we're going to be adding a client medication to the client's medication records because morphine was mentioned in the conversation. So we go ahead and click this, and we go to the client's medical records. We can see that morphine was added as a medication. All right, that's our demo. Thank you so much.